What's happening?
It's good to see you. It's
Good
good
to
to
see.
see you.
Boy,
Huh?
I tell you, I'm so envious of you and your doggone you up there in Canada. I mean, we really could have did this from your location, on location in your spot.
Oh, well just give it time. Give it time. I've got some things in works. I've got some things in play.
Okay,
Things in play. I've got some things in play. I've got some
I'm
things.
glad to hear it.
Oh my gosh. But if you send me one more photo of lobster and not Maine lobster and ice cream, we're not gonna be friends.
Sister, let me tell you something.
It's
Come
not
on
right.
down. Come on down. I got you.
It's not right. That's not right.
I know it. I know it.
Oh
I
my
don't.
gosh. So let me stop Kiki and haha and just get this thing started. Everybody is excited for this evening's chat. And I'm so excited because you've been doing some amazing work. So thank you so much for being here. And you stay busy, booked and busy. So thank you for joining us. I appreciate
Thank,
it.
thank you for the invite as always.
Let's do some intro music because I've got to have the intro music. All right, Crip community, good evening, good evening. Welcome to 30 at 8:30. I don't own the rights to this music, but I love me some Indie-RE. Andrew, I think you do as well. Thought it would be fitting for us in this space. Crip community, for those of you newly joining us, 30 at 8:30 is an Instagram live show where every Wednesday night, for just 30 minutes, we hold the space to have candid conversations with special guests about the impact of so many structural inequities and violence that impact some of our most vulnerable communities. Tonight, we have my brother, Andrew Woods, who I will read his bio, who is joining us for, I think this is episode 4 or 5, I'm losing track, for season 4 of 30 at 8:30, which is dedicated to uplifting the voices of individuals from the front lines. I'm going to turn down the music a little bit, but wait. Now that you hold me, let me show you.
Uh-oh.
Love me some Indie-RE. It's time for her to come up with another album, I think. It's time. It's well overdue. So, again, welcome, Crip Community, welcome. When you come on in the room and hit share. Hey, Upala, what's up? So good to see you all. So good to see you. We are actually doing another episode of season 4 from the front lines. And the title of tonight's episode is No Safe Haven. My brother, Andrew Woods, who's joining us tonight from Hartford, Connecticut, really understands this on a very, very deep level, but wants to make sure that our youth and our families and our communities do have a safe haven. And I'll get into that a little bit more. But before I begin, let me read his bio. In 1998, Mr. Andrew Woods founded Hartford Communities That Care. He is a graduate of Springfield College and UConn School of Social Work. Shout out MSW social workers. Woo woo!
Yep.
In 2004, Mr. Woods established the Hartford Care Response Team, one of 40 plus nationally recognized hospital violence intervention programs in partnership with St. Francis Hospital and Medical Center in Hartford, Connecticut. Then in 2019, the Hartford Community Response Team, Hartford Care Response Team became the first hospital violence intervention program in Connecticut to secure Victims of Crime Act funds. In recent years, the HCRT established a partnership of physicians and skilled nurses that provided in-home wound care for shooting victims released from the hospital, while coordinating their care with behavioral health, outpatient, primary care physicians. This wraparound services that was being done, again, for victims of traumatic injury due to firearm violence. Between 2013 and 2015, Governor Daniel P. Malloy appointed Mr. Woods to serve on 3 commissions. He stays booked and busy, y'all. 3 commissions in the aftermath of the Sandy Hook school shooting in Newtown, Connecticut. One related to victims' rights, another related to the enforcement of victims' rights, and the third focused on youth and urban violence. In 2020, Mr. Woods co-founded the Connecticut Hospital Violence Intervention Program, collaborative, a partnership consisting of hospitals and frontline violence prevention and intervention programs focused on enhancing and sustaining Hartford violence intervention programs in Connecticut. In 2021, Mr. Woods chaired the Connecticut Gun Violence Intervention and Prevention Advisory Committee, resulting in the establishment of a commission on community gun violence intervention and prevention within the Connecticut Department of Public Health. Mr. Woods now co-chairs the commission's partnership programs, stakeholders, and community engagement subcommittee. I mean, come on, y'all, give Andrew a round of applause. I mean, that is, again, staying booked and staying busy, but staying dedicated to the community that needs you so very much, my brother. So, Crip community, please give Mr. Andrew Woods, our guest this evening, a warm welcome, like only the Crip community can. And so you got a lot of hearts going up.
All right.
Yes.
Thank you very much.
For sure. Now, I'm just going to say it because I didn't say it in your intro. For all of you joining us this evening, I'm taking special pride on having Andrew here tonight, as he is joining us from my hometown.
That's right.
Of Hartford, Connecticut, where I was born and raised.
Mm-hmm.
So shout out to all my family, my friends, and my sorors. Andrew, you know I had to take a moment to say hello to everyone back home. But thank you again so much for being here tonight. Thank you so much.
I brag about you all the time.
Oh, thank you.
You.
And as I you. So I'm gonna start off some questions.
Okay.
And the first what drew you to this work, Andrew? What drew you to this work?
Back in 1990, I actually started doing drug treatment services at a local detoxification center, 30-bed detox, to where that was my first foray into doing clinical work, primarily with those with substance use disorder. But it wasn't until maybe a few years out that I began to experience burnout, quite frankly, and frustration, because this was a detox, high levels of recidivism. And one of the things I wanted to do was catch young people before they even got to that point. Right. And so what I decided to do as an outlet was really go and volunteer at a middle school and start working with young people from a prevention standpoint. Yeah. And that's how we actually started what was called then the Violence Youth Leadership Academy, where I wanted to train young people to do, believe it or not, to your audience, not just intervention or prevent leadership development. It was really in the context of public health and public policy work. So I wanted to teach young people how to do research, develop communication skills, public health practices, do key informant interviews, focus groups, that sort of stuff, and then combine all that data and information and pull it together and present it with public policy and programmatic recommendations to lawmakers. And so basically what I wanted to do was teach young people how to do public health and public policy work. And these were 7th and 8th graders, because I knew at that time that if I allowed them to gain those skills, they were transferable no matter what industry they went into. And so consequently, when they went off to high school and college, they became academically very successful, career-wise very successful. And no matter, again, what industry they went into, they were going to excel. And so for me, a prevention program was really all about making sure they had transferable skills, critical thinking skills that would empower them no matter what they decided to do. And that still, by the way, still happens today. That institute is still in place, and it is the founding institute of our organization.
I want to share with the Crip community, if I may, some of the things that you said, because I don't want it to go unnoticed. Starting young, 7th and 8th graders, but also understanding that grants are good, right? Grants are great. Money is great. I like money. I like money.
No doubt.
but in the absence of money, what are the assets? What are the things that we can amplify that already exist in our youth, and help give them the skills so that they have sustainable income, sustainable skill set after the money dries up, after the programs go away, even though this program is still continuing. That's just critical to violence prevention work. that I
That's right.
think sometimes people miss. They miss that. Yeah.
Yeah, absolutely. And the strange thing about that is that in every community, no matter what, how many resources you might have in the community, everyone still has adults who have gone either to school or who have a career, who are in, whether they're in the faith community, civically engaged, you name it, whoever these mentors are, and they're not even don't have to even be defined as mentors.
That's right.
We just have natural resources that we can tap into, that young people can take advantage of those skills, those assets, and then to be able to parlay those experiences into something much more meaningful them down the line.
Yes.
And so that's what I found. So quite frankly, the first 5 years of doing this, it was all volunteer. 20 hours a week volunteer at a middle school. And you remember doing this work. And all I had was just a few dollars here and there, much out of pocket, but also some generous donors. Guess what the generous donors were? Someone who gave me $5 to make sure I had a Burger King whatever, or a lunch pack for a kid or something. But it wasn't a lot of resources, but there was a lot of energy. It was concentrated, and we made sure we had opportunities for young people to thrive in. And that's really, quite frankly, all young people want. They just want an opportunity, a safe opportunity to thrive in. They don't need a whole lot at that juncture.
Not at all. Not at all. Oh my gosh. Thank you so much for the work that you do. I have to give a shout out because this is the first time I've seen my little brother. And yes, I'm calling you out, Malcolm J. Murray on the line, but welcome to the Crib community, Malcolm. Welcome to the Crib community. You got all Hartford folks, Andrew, coming out the woodwork to watch and hear what you have to say and supporting you. I just want to let
I better sit up in my seat then.
Folks are showing you mad love. They're showing you mad love.
Thank you. Thank you, folks.
So I want to delve deeper into Hartford communities that care. And I'm wondering if you could tell us a bit more about that, but specifically how this program in particular supports victims of gun violence injury, those individuals that survive firearms, but also those individuals that have to experience the horrific and survive the horrific reality and traumatic experience of surviving the homicide of a loved one. How does Hartford Communities That Care support both of those individuals of traumatic injury?
Well, it's interesting that when I was doing that work early on with those 7th and 8th graders, unfortunately, even during that time, there began to be an uptick in youth violence, gun violence in particular. And what we would find ourselves doing was that we would find our young people at the hospital, at the emergency room. And the hospital would go into lockdown. Parents were frustrated with not being able to get access to their family members to get an update. Young people were outside. They were angry, obviously, because they couldn't get information on their friends. And then they were talking about, in many cases, unfortunately, around retaliation at the hospitals and so forth. And what we decided to do was partner with the hospital and said, hey, listen, if you're going to go into lockdown and families can't get access to understanding what's going on with their loved one, then you give us a call. And we will be there within 10 to 15 minutes. And to this day, since 2004, we respond to that hospital within 10 to 15 minutes to make sure that we get families access to medical providers to get an update on their loved ones. Now, we clearly know why that's critical. One is that everyone deserves, now, if this was an auto accident, that hospital would not go into lockdown. If this was a person who had broke their ankle, the hospital would not go into lockdown. But when it comes down to Black and brown young people being violently injured, and when they arrive at the hospitals go down into lockdown, and the treatment that these young people and their families receive, quite frankly, isn't appropriate, is deplorable. And so what we decided to do was broker that and say, you call us, we'll identify who the key family members are. We get them inside a private room. We make sure that they get an update from doctors and nurses, et cetera. And then, by the way, we'll follow up with that family to make sure they get connected to victim service supports, a range of different services, including some of what you mentioned earlier in terms of wraparound service supports. Ultimately, that's where we evolved to. And so that's really what the whole aim was that we got frustrated, and so did our community, with the disparate treatment that they were receiving in the emergency rooms here in the city of Hartford and so forth.
I'm jumping out of my seat, out of my skin right now because you're giving a sermon. So let me collect my thoughts, because I'm also recognize I'm speaking to two different countries. And I want for my Canadian sisters and brothers who are, this has been going on in the States, in particular in cities like Hartford, Connecticut, Philadelphia, Pennsylvania, Chicago, Illinois, since the late 80s, early 90s, right? So Mr. Woods is really uplifting a lot of the initiatives that started early, but also I want something else not to be missed, the stark intersectionality of multiple traumas. The trauma of anti-Black racism and the trauma of chronic exposure to cumulative Black and Latino death, in particular in the United States. And if we are not entering the space with an understanding of how those traumas work and how we must be culturally responsive to intervene with the families and the victims, then we are missing the mark. And so for my Canadian brothers and sisters, where we're just now starting hospital responders programs, hospital violence intervention programs, there is a lot to be learned about culturally responsive approaches, just as my brother and dear friend Andrew Woods is doing here, so that we need to take heed to as we move forward for Black and Indigenous communities here. So thank you so much for sharing that tonight.
Absolutely.
Thank you. I want to oh my gosh, there's not enough time, but I want to uplift a couple of questions. Oh, I'm so excited. You get me, I got goosebumps to answer your question. In an article that was written in 2020, you spoke about the importance of categorizing the increase of gun violence and shootings in vulnerable communities as a public health emergency. And therefore, it should be treated with a similar sense of urgency to the COVID-19 pandemic. Now, because you know me, when I heard the article, my spirit was saying, yes, tell it. But for the Crib community members joining us this evening who were not privy to the thoughts inside my head, can you tell us what you meant by that comment? What did you mean by that comment?
Well, let's go back to mass shootings. Let's go back to mass shootings and the response to mass shootings. Remember, we're from the state of Connecticut, where we had the unfortunate Newtown mass shooting, where many young people, children, babies, were killed. In the aftermath of that, we saw a response that was both political, a public health response. We saw a public policy response, and a public policy response, public health and public policy response that was enormous. Connecticut became one of the first states in the nation to really implement very stringent laws around the use of guns, especially long guns, etc. And many resources were devoted towards dealing with that community, and much as it deserved. However, much like COVID and much like, say, bioterrorism or national disasters, when we talk about pandemics, when we talk about a public health emergency, when it comes down to urban gun violence, that same reaction, that same response is not afforded to Black and brown victims of gun violence.
That's right.
But yet, when you, in the totality of gun violence in urban areas,
that's right,
it is a pandemic. It is certainly an epidemic, but it does not receive the same attention as a COVID-19 response or a mass shooting response. And that is what I was referring to in the article.
That's right.
Because we know when we define things that way, again, taking natural disasters, we see, all kinds of resources flood into those communities. But again, we call it the empathy gap. When it comes down to Black and brown individuals, that empathy gap is very, very large. There's very little empathy for victims of gun violence in urban areas, and therefore you cannot expect to see that kind of public health response.
Absolutely. And again, I want to thank you for breaking that down, and I want to explain again, thinking about the fact that we have two countries watching. For again, my folks who are watching tonight and tuning in from Toronto, Canada, in the United States, 17,000 murders on average occur in the United States each year. Now, in the United States, we collect data by race, where I know Canada does not. So we can tell this story. We know the numbers, and yet they're still ignored. but 17,000 murders occur each year on average in the United States. And African Americans, Black people, make up roughly close to 14% of the US population, and yet they account for close to 70% of homicide victims. So if you just look at the numbers alone, there's a disproportionate reality of cumulative and chronic Black death for Black communities, for sure. So that's a little bit of what, so the data to support what Mr. Andrews is saying. I have a hard time with Andrew, my brother Andrew. Also, I want to shift gears to mental health, particularly with us as social workers and so many social work students watching. In a letter that you wrote to the Bipartisan Task Force on Gun Violence Prevention and Children's Safety, you said, although much has been discussed about mental health screening and treatment, I would suggest the panel consider the mental health impact violence has on urban youth who have far too long endured the trauma and grief associated with gun violence. What is the mental health impact of chronic long-term exposure to gun violence for youth?
One thing is real clear to us, even as we speak right now, is that the impact it has when we talk about anxiety levels, significant increase in anxiety levels among people in urban areas that have been chronically exposed to violence, increased depression among young people, teenagers, children, suicidal ideation. We very rarely talk suicidal ideation in the Black community, but I'll tell you, the data is now just bouncing off the charts in terms of suicidal ideation among young Black children in even the elementary school grades, etc. And that's, happening all over the U.S. And certainly increased social isolation, the way young people do not feel that they even have a social network or family network to share the vulnerabilities that they feel, at the uncertainty that they feel around just what they're encountering. So give you an example. When COVID-19 hit, we all know that just really just showed everything, stuff that was there and then stuff that people didn't know was there. And really, when it comes down to isolation, young people really dug in from an isolation standpoint, and they are still struggling to pull themselves up out of that to begin to re-engage even their own peers in productive, healthy ways. And these are ways, from a mental health standpoint, that chronic exposure to violence and all the other challenges that folks are faced with and how it's impacting our young people. But also increased drug use, early initiation of drug use, increased delinquency amongst many of our young people, and so forth. I want to go back to one point too, when we even talk about victims, direct victims of gun violence. And this ties into mental health, is that oftentimes when a gunshot victim is in that bed at a hospital, and say a law enforcement officer is allowed to go in there to talk with the person and they're resistant, or the doctor goes in or a nurse that goes in and they appear to be resistant, what people don't realize is that person is not being hostile put it this way, they're perceived as being hostile, angry, and combative, when in fact a trauma victim is really just scared, period. Think about it. They just got violently injured. Hello.
Right.
But yet their only remaining defense is to put up a shield.
Yes.
Because they're at their most vulnerable state. Yes. And so providers and the general public might perceive them as being hard and callous as even a victim of gun violence, when in fact, again, they're just scared. They're frightened and they don't know who to trust. And certainly our health systems haven't given a real good reason to trust them, given historical conditions and circumstances. And so I just want to make sure we put that out there, because that too ties back to, how do you help individuals? How do you support them if you don't understand how they come into this space? Or put it this way, how you should be coming into this space if you want to work with and support victims of gun violence in our community.
That part right there, that part. Woo! Mic drop. I gotta get my sound DJ stuff back. Production, we gotta work on this. Um, so you've been been a critical long-term advocate for ensuring that those who have been exposed to and are survived the homicide of a loved one are equipped with access to various mental health supports. What are some barriers? And I think you've mentioned a couple of them, right? But what are some barriers to preventing people from accessing these supports, and how do we overcome those barriers?
Well, certainly, I'll give a few examples. We talk about cost of services and those that could not pay for services for a variety of different reasons.
Mm-hmm.
So one, the high cost. In other words, even if they had the ability to pay, it may only be for a few sessions. And then there is the fact that, especially given this day and age, folks are just, they can barely buy milk and gas to get to work or to feed their children, let alone pay for clinical services. And so we want to talk about a solution to that. It's really about us as providers. So give an example here at Hartford Community That Care. There was a reason why I connected with nurses and clinicians to go into the home to do wound care and behavioral health care for victims of violent crime. We are actually one of the first in the nation to actually have nurses, and now, by the way, doctors go into the home to do home visits, to do both wound care and physicals. Then we route them back for primary care. Now, an individual that may not have had a primary care physician for decades or years, they're now connected to a primary care physician. And then, of course, you identify, ways by which to support that. And that could mean that you're finding alternative resources to make sure they get that care consistently, or that they get connected with a public health benefit that can help pay for that service, etc. So dealing with the cost and dealing with the access to care, you really have to get innovative. You have to identify partners who already have the resources. So give an example. 90% of gunshot victims in urban areas, Medicaid covers that cost. They're not commercially insured. So they're not covered by the major commercial insurers like Blue Cross, Aetna, Cigna, etc.
That's right.
It is Medicaid, which is a public health plan or health taxpayer dollars that pay for the cost. And so therefore, you make sure you reconnect them to that until they are gainfully employed, or they receive, or they're able to tap into commercial insurance to, provide even more or better quality of care if they're not already getting that or or getting that under Medicaid. Another is the lack of services or providers in the community. Here again, it's really about identifying community individuals of color or people within this community who don't have a problem with coming out and meeting our clients and our families where they're at. And by the way, where they're at doesn't mean in your office.
Right.
What it means, what it means is that if you got to go meet somebody out there on their block, at their home, and etc., then that's where you meet them at to provide that service. And those are the kind of providers that we seek to partner with who are willing to do exactly that. And by the way, there are some folks who are, but unfortunately, there are many who are not. And so the system is still set up to where, well, they don't show up, they don't get the service.
Right. It's interesting here again, healthcare. You've provided such tremendous insight, which is, I knew that you're going to do that, but here in Canada, the healthcare is free. Right. But some of the same issues that you're bringing to bear in terms of are the individuals who are providing the service culturally responsive? The wait lists are so long for people to be seen here that oftentimes they have experienced another firearm injury or, God forbid, a fatality. But also the idea of how can we think strategically? How can we collectively pull together our assets and expertise to think about the provision of care differently, but making it accessible by going to the people where they are. But also this idea, you have me. My thoughts are, as I tell my students, pinging a lot. So we're going to talk about some more of this a little bit later. About that, but thank you for that. I want to actually ask something that we have asked of all of the guests this season, particularly when I know, Andrew, something that you haven't shared, but the countless hours, 1 a.m., 2 a.m., I'm watching you post on Facebook, it's 2 a.m. This is the third time I've been out tonight responding to a shooting. And I think it's important to ask this question of frontline workers that don't often get recognized for the work, the Herculean but God-given work that you do. When you think about the support that you're giving to communities, just overwhelmingly impacted by firearm injury and fatality, how do their experiences impact you as a frontline worker? Where do you go for support, and what do you still need to keep going?
Well, first thing I always like to tell folks is that the work is still tremendously rewarding, because you know that at the end of the day, you're still providing a service and supports for folks who, quite frankly, may not encounter someone like you during those settings. Yeah. And so it is vitally important that if a person is violently injured, that they can see and look up and see someone like myself or our staff that's there and who is an advocate. We consider ourselves as victim advocates. We don't work for the hospital. We don't work for law enforcement. We operate an independent, nonprofit, community-based organization, and we are advocates, period, at the end of the day. And so that is vitally important. And so the reward behind that is knowing that you're providing the service. But also it's frustrating. It's depressing. It's traumatic, and it takes a toll that, quite frankly, we very rarely talk about. Because at the end of the day, you still got to get up and dust yourself off and go back out there and do it again. And the people that you're seeking to help, you can't present to them as being a person who also needs the same help. Yeah. And so forth. And so you have this struggle that we do have to manage. So to your point, how do we manage it? How do I manage it? How do I work around that and deal with it? I've learned to tap into family and to not isolate from family, because that happens very easily as well, especially when you're going through distress, because you don't want your own family members to experience that and see that you're also experiencing that same level of stress. But also I have friends. I have a cohort of friends that I rely on, that I can talk to. I still have mentors. I've had mentors ever since I was a child. And I've been very grateful to know and understand the value of having a mentor, or not quite frankly one, but several. And then, of course, my faith. I'm a firm believer in the Holy Spirit and the power of the Holy Spirit. And what that means to me every time I get up, every time I go to bed, and when I enter my daily life or my daily activity, and recognize the power of God's grace and that spirit. But also periodic therapy. I used to be in therapy for periods of or significant amount of time, but now it's more periodic than anything, because I've found alternatives. And basically, you talk about me posting some of what I call the horror stuff. But yeah, I post my lobster rolls because I'm a lobster roll man. I post my scenic drives because I go all throughout I'm a backwoods kind of guy, and I love trees. I love ocean. I love water. I love all those.
Beautiful photographer. But go ahead.
Thank you, sister, very much. And right now we're going into foliage season, and I know you guys, your leaves have probably already peaked by now. And if they haven't, I know it must look lovely up there, and I can't wait to get to Canada to see you.
I got you. I'm picking up what you're putting down. I got you.
Thank you very much. I appreciate that. So it's really about making sure that you get a variety of different things that feeds your soul, that allows you to witness and experience other than what you get out of your day to do in terms of your day job, if you will, or in our case, the evening job. Of getting out of our bed at night. And that's what I encourage the people that I hire and I train, is that, listen, it's not just about this work. It really is about how are you going to develop partnerships, relationships, and activity that will give you much more reward as a person, and much more the reward that you deserve. And so that's how I do it.
I thank you for sharing, but in this moment, I have to share with you that I'm actually tearing up, because I realize that the responses to so many folks that I care deeply about, and so grateful for the work that they do, that each of your each of your responses to that question are incredible gifts for me on how I need to really think about the long haul, the gifts we've been given to do this work, but how do we sustain it? So I really want to thank you for your responses to that question.
Thank you.
What is your greatest hope? Because I recognize we're 3 minutes over, but what is your greatest hope for Hartford communities that care? What is your greatest hope?
Well, let's go back to when I got started. It was really all about building a bench and making sure that young people had access to opportunities, that they could establish careers and whatever they decided to do and be successful. At the end of the day, as an organization, we still consider ourselves a training institute, an incubator, to where young people that come to work for us or volunteer for us, that they gain as many skills as possible to where they can parlay that into other opportunities, be successful to continue to do mission work or whatever they feel is, again, basically what the mission work, if you will. But at the end of the day, HCTC has been set up and designed to be an incubator. It is a program provider, a direct service provider, an advocacy organization, you name it, that does policy work, public policy work. But at the end of the day, it's still about training people, employing them to be advocates, service providers, to make sure that they meet the prevention, intervention, treatment, and recovery needs of those in our community. And so as long as we're doing that, as long as we're providing that opportunity and not leaving our community vulnerable, because that's what happens. If we don't build the bench, we leave our communities vulnerable to where they're not people like us that are. If we don't build the bench, we will not have people that look like me out here doing this work, quite frankly. And to me, that is the biggest crime of it all. One, we don't support this work, but on top of that, we got to build the capacity of our neighborhoods in our community to make sure these kind of services are available. And for me, that is the biggest wish for HCTC, to continue to do that.
Thank you. Thank you. Thank you. Thank you for everything that you do and all that you are, Brother Andrew. I truly, truly, truly am grateful. Grateful for
I was nervous to come on here because you was one of the first big shots doing this work in the city of Hartford,
It's just us having a conversation.
All right, okay.
It's just us having a conversation, my brother. And it takes a village. It takes us all to do this work. And, I am because you are. So let's make that clear. But thank you for the compliments. Thank you for
likewise.
Andrew, thank you so much for being here tonight. We could go on and on and on, but it is 30 at 8:30.
All right.
You have mad love coming up in the I love you too, Macy. That's my goddaughter on the line.
Right.
But you have mad love and shout outs coming from Hartford, Connecticut, coming from Toronto. Folks have just really learned so very much from you this evening, as have I.
Well, great.
And so, Crib community, as always, from our crib to yours, stay safe and keep well. Good night.
Okay, good night. Love you, sister.